I'm here because there are other people here who are suffering from psoriasis. They would be able to tell their stories, which I think is important. I'm gonna write a song about them. The whole thing about being sick is you feel alone. The more you talk to other people with it, the more empowered you feel.
It's empowering.
It's real important to get the word out that, like, yo, there's hope. I didn't wear shorts for 20 years, and I wore long sleeves. I didn't go to the beach. It's just frustrating.
I couldn't even wear pants after a while because it hurt.
Yeah.
I used to remember sitting a certain way because one side of my head was covered, so if people were in a room, I'd like sit this way.
I wouldn't do this before. I would never put my arm up here because it would be a little trail where my elbow was.
People need to see that you can be clear.
I was desperate.
I was so desperate. I started getting psoriasis when I was 26 years old, so I've been chasing results ever since.
After failing a couple of medications, I went in for a recheck, saw my derm, and she suggested Cosentyx. My doctor and I did it together, my first dose. And so she did one and I did one, and then we hugged, and by the time I went back, I was almost clear. She literally slid down the wall and just cried with me.
Rock and roll, kid.
I wish I would have pushed a little bit more to go to biologics quicker. And I remember seeing the commercials for Cosentyx. And so I talked to my, at that time it was my rheumatologist, not my dermatologist, because I also have psoriatic arthritis. And he recommended to try that next.
How long are you clear?
So almost 2 years.
Good for you.
But having a good doctor makes all the difference. I met a guy who I was friends with. He lived in my building, and he saw my hands, and he said, "You should come see me about that." I said, "I'm a dermatologist. I specialize in psoriasis." And Cosentyx was the first thing that he said, "I'm seeing amazing results with my patients. I think this is for you."
And you got such nice skin.
Oh, yeah.
You know what's really cool when you first get on Cosentyx? Every morning you wake up and you look, and it's like a little better, a little bit.
I know I haven't been clear this long.
I have the confidence to just go out in public and not worry about the stares and the comments and questions and everything from everybody.
I haven't been on a vacation since my skin was clear, and I'm so excited to sundresses and all of that.
There are people suffering, and some people don't know that there's a way to get clear skin and keep it that way.
This drug actually working and working for a long period of time.
Yeah, I wish I knew about it earlier.
It's crazy when somebody compliments my skin, and they don't even know where I have come from. And so when I get a compliment like that, it means so much more.
It works. Living life, loving it. No one's staring at me for the wrong reasons. Sometimes they stare makes them good looking, but what are you gonna do?
It's not every day that you get to sit with other people who experience the same thing. I'm very grateful. I really am. Cosentyx worked for me, worked for the people around me. It was great to hear their experience. I want to write about hope. I want to do a really good job where people feel better. Music should help you feel better.
Indication. Cosentyx, secukinumab, is a prescription medicine used to treat adults with moderate to severe plaque psoriasis that involves large areas or many areas of the body, and who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet or UV light, alone or with systemic therapy. Important safety information. Do not use Cosentyx if you have had a severe allergic reaction to secukinumab or any of the other ingredients in Cosentyx. See the medication guide for a complete list of ingredients. Cosentyx is a medicine that affects your immune system. Cosentyx may increase your risk of having serious side effects, such as infections. Cosentyx may lower the ability of your immune system to fight infections and may increase your risk of infections. Your doctor should check you for tuberculosis, TB, before starting treatment with Cosentyx. If your doctor feels that you are at risk for TB, You may be treated with medicine for TB before you begin treatment with Cosentyx and during treatment with Cosentyx. Your doctor should watch you closely for signs and symptoms of TB during treatment with Cosentyx. Do not take Cosentyx if you have an active TB infection. Before starting Cosentyx, tell your doctor if you are being treated for an infection, have an infection that does not go away or that keeps coming back, have TB or have been in close contact with someone with TB, think you have an infection, or have symptoms of an infection, such as fever, sweats or chills, muscle aches, cough, shortness of breath, blood in your phlegm, weight loss, warm, red or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinate more often than normal. After starting Cosentyx, call your doctor right away if you have any signs of infection stated earlier. Do not use Cosentyx if you have any signs of infection unless you are instructed to by your doctor. Inflammatory bowel disease. New cases of inflammatory bowel disease, or flare-ups, can happen with Cosentyx and can sometimes be serious. If you have inflammatory bowel disease, ulcerative colitis, or Crohn's disease, tell your doctor if you have worsening disease symptoms during treatment with Cosentyx or develop new symptoms of stomach pain or diarrhea. Serious allergic reactions. Serious allergic reactions can occur. Get emergency medical help right away if you get any of the following symptoms: feeling faint, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing, or throat tightness, chest tightness, or skin rash. If you have a severe allergic reaction, do not give another injection of Cosentyx. Before starting Cosentyx, tell your doctor if you have any of the conditions or symptoms stated earlier for infections, have inflammatory bowel disease, Crohn's disease, or ulcerative colitis, are allergic to latex, the needle caps contain latex, have recently received or are scheduled to receive an immunization, vaccine. People who take Cosentyx should not receive live vaccines, have any other medical conditions, are pregnant or plan to become pregnant. It is not known if Cosentyx can harm your unborn baby. You and your doctor should decide if you will use Cosentyx. Are breastfeeding or plan to breastfeed. It is not known if Cosentyx passes into your breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Know the medicines you take. Keep a list of your medicines to show your doctor and pharmacist when you get a new medicine. How should I use Cosentyx? See the detailed instructions for use that comes with your Cosentyx for information on how to prepare an injected dose of Cosentyx and how to properly throw away, dispose of, used Cosentyx Senso-ready pens and pre-filled syringes. Use Cosentyx exactly as prescribed by your doctor. If your doctor decides that you or a caregiver may give your injections of Cosentyx at home, you should receive training on the right way to prepare and inject Cosentyx. Do not try to inject Cosentyx yourself until you or your caregiver has been shown how to inject Cosentyx by your doctor or nurse. The most common side effects of Cosentyx include cold symptoms, diarrhea, and upper respiratory infections. These are not all of the possible side effects of Cosentyx. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.